So good morning, everyone. I see a lot of familiar names and faces. So happy to have you here. So welcome all to the Amherst Area Chamber of Commerce Pivoting in a Time of Uncertainty, a panel discussion for creating new opportunities for nonprofits. This program will be led by Prosper co-founder and CEO Kevin Fleming. Kevin, you want to say hello? Just say hi. So show your face.
Hello, thank you so much. Looking forward to it.
And co-founder and chief strategist Alex Nefer, partner of Prosper and Nonprofit Advising. Alex?
Hello, good morning.
Today's webinar is made possible by our presenting sponsor, People's Bank. I just want to say People's has been a vital partner long before COVID, and certainly during, and pivoting along with us. So within this theme, when they say, when life changes, we make it easy to change the way you bank. They truly practice this. And with shifts in our own ability to offer programming, they have shifted along with us. So, and for that, we continue to be grateful, but we also know that our relationship to People's Bank is stronger than ever. So here's Matt Bannister, First Vice President for Marketing and Innovation, to say a few words. Matt?
Oh, thanks. And thanks to the participants, the panelists, Prosper, and probably most of all, thanks and props to the Chamber. You know, we're here to talk about pivoting today, and I'd have to say the Chamber has been one of the most resilient and active and engaged community forces over the past unprecedented 5 months, and pivoting in ways that many of us thought we never would need to do. So to Claudia and John and your team, thanks for all you're doing for us. People's Bank is proud to play just a small part in keeping these conversations going. So thanks for inviting us to help sponsor today. I've had the good fortune to work alongside several of our panelists today, and this should be a great discussion. So without further ado, thanks again, and let's get on to talking about the great pivot.
So before I turn it over to our moderators, there's some housekeeping for our discussion. This is a 90-minute session, but we'll try to keep it even shorter if possible, but as illuminating and as we can. But today's panel is being recorded, and we will share it with all of our participants immediately following, and we'll also be posting it on our YouTube channel, where we have all of our previous conversations, so an educational panel. So feel free to peruse, and they're all found at amherstarea.com. And we will be hosting the panel and resources related to a topic or question. So if you have resources or questions related to the panel as we move along, please post and share in the chat as they come up, and we will then go back to them as appropriate, but we may leave the bulk for the Q&A to follow the panel conversation. So I hope that makes sense, but again, feel free to use the chat for sharing, and I thank you all for joining us. And again, a reminder to stay on mute, just so it diffuses sound issues. So thank you all for being here, and over to Alex and Kevin to take over moderation.
Thanks, Claudia. I just wanted to take a moment here to thank you, Claudia, and also John. I remember it was early in 2020, before we were under this pandemic, that you first approached us about the possibility of doing this panel. I know it's taken a much different form than we originally imagined, but I want to thank you and John for your persistence and eagerness to put this together. Our hope is this will be a shining light, a little bit of positivity during this time for everyone. We're hoping everyone walks away feeling inspired by some good stories about pivoting and kind of maybe changing the fortunes of things. I'm going to introduce our panelists real quick. Dr. Yves Salomon-Fernández is president of Greenfield Community College and a thought leader in higher education, rural innovation, and women's leadership. Dr. Salomon-Fernández, thank you for joining us. John Bidwell. John is the executive director of the United Way of Hampshire County and has a wealth of experience in nonprofit leadership and management, and is the co-author of Beyond Shores, From Holocaust to Hope. John, thank you for joining us. Third, and certainly not least, Eliza Lake. Eliza is the executive director of Hilltown Community Health Center She has been there since 2010, having worked as a consultant to state governments, various area nonprofits, and as the Director of Community Supports and Services in the Massachusetts Office of Elder Affairs. Eliza, thank you for joining us. So, with the introductions out of the way, I just want to introduce myself. My name is Alex Neefer. I'm co-founder of Prosper Nonprofit Advisors. We provide consultation services for nonprofit organizations looking to grow their funding and their engagement with either their members or their constituents. I'm joined also by Dr. Kevin Fleming. Kevin has over 20 years of expertise in alumni engagement and nonprofit management, and is a thought leader in the areas of alumni engagement with published articles on alumni engagement theory and fundraising practice. Kevin, thanks for joining us. All right, so unless there's anything from Claudia, John, or Kevin, or any of our panelists, I'm just gonna jump right in here with the questions.
I just want to thank the three panelists. I'm really excited that you're all here, and for all of you investing this time today with us. Thank you.
Thank you.
All right, so you know, this first question can be answered by any one of our panelists, but as this crisis has evolved, what has been the biggest challenge or challenges to being able to deliver on your organization's mission?
Well, I'll jump in. We're all being very polite. So United Way has spent really years working on how we support the community. And the feedback that we'd received up until recently was nonprofits really need long-term stable support for their agencies, which is what we've delivered on. So we give 3-year grants, and we have a very thorough system, and it really requires a lot of time, right, in order to do it correctly. And then COVID comes along, and all that time evaporates. And suddenly we're being asked to respond in an emergency way, not a long-term support way. And so the crisis really said people need funding, they need volunteers, they need supplies, ASAP. They don't want to wait until there's a grant process that opens up. And so it became incumbent upon us to learn how to say yes very quickly.
I don't know if Yves wants to go next. So hi, I'm Eliza. And I just want to thank the organizers of this. I really appreciate it. And I'm thrilled to be with John and Yves because as fellow colleagues, we see each other in other venues, but it's been a while, so this is great. I want to first say that Hilltown Community Health Center is the umbrella organization for the Musanti Health Center, which is in Amherst, which is how most people in Amherst know us. We're a community health center in the Bang Center, which means that we provide medical, dental, behavioral health, and optometry services to everyone regardless of ability to pay. So being a healthcare provider, our biggest challenge was first and foremost the safety of both our patients and our staff, and particularly our staff. We know that there have been cases around the country of people not focusing on the safety of their staff. And since we are essential workers, critical infrastructure, we did not ever close, and we couldn't send everybody home. We sent as many as we could home. So safety was a huge issue, which means things like looking at our actual physical structure, looking at PPE and how do we get PPE. But the biggest challenge we had is that we need to keep serving people who are very vulnerable, and particularly people who don't have access to care elsewhere due to barriers of language, of lack of insurance, transportation, and how do we, nimbly be able to transform what we do to maintain as much access as possible within what we were being told by the state we were allowed to do. And then the last thing that is, not small is the hit to our revenue, which obviously businesses have been seeing this. Our dental and eye care practices went down to 10% of the volume that they had had. Our medical was down to 40%. And the one, silver lining was our behavioral health was able to pivot entirely to telehealth. So that actually remained at 100% of the access that we had before. But so trying to negotiate all of these changes while seeing our revenue, go down to 20% of what it was, or 25% was really challenging.
And I would add that my comments are very consistent with what John and Eliza just shared, but I want to pivot. I want to build upon what Eliza shared, which is the financial aspect, right? Because there's so much uncertainty, there's so much ambiguity. So in terms of financial planning, you have one picture and then things change. And when we started this back in March, we were the second community college in the state to say that we were going to be going remote. And what we thought was a couple of weeks, we'll clean the college and then we'll be back. Well, after those couple of weeks, we realized it could last through the end of the semester. And then by the time we hit the end of April, we realized, oh gosh, this could really be through next semester. So we were actually the first community college to say that we would have a fall semester online, and realizing that that has not just financial implications, but it also has implications for public health. We are not just the college, but we are a commuter college. So students come in and out, and the probability of the rate in Franklin County increasing, the rate of infection increasing, was very real to us. And what role do we play in maintaining our community, both the college campus safe and healthy, but also the broader communities, because our students come from Franklin County, Hampshire counties, and southern New Hampshire and southern Vermont. So we had to keep that in mind. I would say one of the hardest parts has been challenges that we've encountered has been engaging students and providing student services online. Things like counseling and tutoring. Students are accustomed to having those face-to-face. So how do you offer those same services online? How do you move your entire operation at the same time that the entire world is shifting its operations? So being able to plan and start very early and plan for the worst case scenario allowed us to miss some of the supply chain issues that a lot of institutions were facing, because we planned for the best, we hoped for the best and planned for the worst. And so it ended up working out in some ways to be in our favor, that we had the worst in mind. And so we did not encounter some of those supply chain issues, but engaging with our faculty and staff remotely, just as it is for students, has been challenging.
Thank you, all three. That very thoughtful responses. Just in follow-up, John or Eliza, it would be great to know, how your organization has adapted to the challenges that you previously stated, and what ways are you getting creative to continue your operations or delivery of your mission? Also might be helpful to understand some of the factors that went into your decision-making process for moving forward.
Well, I can say that we are lucky, and I'm seeing this more and more as I watch schools struggle, because we did get very clear guidance from the state, at least about what we shouldn't be doing. And so that was sort of made it easier for us to make some decisions. And we continue to get a lot of guidance from DPH. So that was certainly helpful in how we addressed some of the challenges. But I think to what Yves was saying, our biggest challenge was we had to transform into a telehealth only organization overnight. And I would say, and telehealth means both phone and internet. So we were able to do the phone piece of it, I would say easily within 3 days. All of our visits were moved to telehealth, including some dental visits, which is always challenging to imagine, but and I guess now everyone's experiencing what that might look like. So that was a huge undertaking that required new teams to be developed and new processes, lots of new protocols, and really meeting, daily 2-3 times a day, all of management, all of the departments working together. And so this will be a sort of this, Alex was saying, the positivity, seeing people come together and work incredibly well together to solve problems, to collaborate, was just a wonder to behold, really. We had to create a new clinic for people with respiratory illness. We had to build new alliances and well, not new, but really work hard on our relationships with other local healthcare providers. And then the big thing that we also do besides healthcare is working on what we call social determinants of health. But as a community health center, we help people with their food needs, housing, domestic violence. And so figuring out how to transform all of those too, and how do we support our patients and clients with their needs that go well beyond healthcare. And so developing all of those. And so mostly I think how we were creative was making sure that our staff had the tools that they need. If they needed something, we got it to them immediately to be able to address all the needs and to develop these new structures that we needed in the space of 2 weeks or 3 weeks. And we're still building new structures, but that first month was sort of all hands on deck.
I think in our situation, what we did is, it's amazing when I look back on these sort of little mini quick conversations and debates that we had early on out of this, because suddenly we're faced with a situation that none of us frankly is really prepared for. And so there's a few things that floated to the surface pretty quickly. One was connections. You know, one of the things we forget is that any of the organizations here has an immense network that we've developed over the years, and we realized that that was a strength that we had. So when people came to us and they had requests, we may not be able to give them exactly what they needed, but chances are we could find someone who could. And so we recognized our connections as a strength, and when someone came to us and they made a request, we said yes. We basically said, if you're a partner agency, we would say yes to you. And a partner agency is an agency that we fund. If you're not a partner agency, we're going to say yes. If you're a municipality, we're going to say yes. We're not sure exactly how we're going to help you, but we promise we're going to figure out how to help you. So connections and saying yes was a very important first step. Another important first step was deciding, hey, we're going to play a leadership role even if we don't know what the answers are. We're going to get involved in the conversations. We're going to make sure we can do what we can do. We're not going to retreat to the back because we don't feel like we have all the answers. And that can be a little uncomfortable, because when you spend years deciding how your operation is going to be run and suddenly everything's tossed up into the air, a very valid response is to say, hey, we're not prepared for this. We're going to let others take the lead on this. But we decided, no, we're going to step in even if we don't know what we're doing. And the third piece is communication. And when this first came out, if you remember, there was a flood of communication from a lot of organizations sharing information. And we had people come to us say, hey, look, why don't we back off on the communications? There's enough out there right now. We're just going to add to the cacophony. Let's just back off and give it a breather. But when we talk to people about best practices in crisis situations, you're supposed to step up your communications, not back off, providing you have valid information. So the third most important step that we did is we stepped up our communications by about 400%. So quarterly newsletters became weekly e-newsletters. And we really scoured the information to make sure that what we were providing was actually of help to people. Are we providing opportunities to get help? Are we providing opportunities to help? Are we offering things that other organizations need? Are we updating people on information that's important as it's relevant to United Way? So I'd say the connections, the leadership, and the communication were the three biggies coming right out of the gate.
Fantastic, thanks. Yves, I did want to give you an opportunity just to add anything if you thought you'd like to that question.
No, I think I agree with a lot of what everyone has already said. What I thought was great coming out of this is the leadership that we have a deep sense of community around here. And I think it's just the nature of who we are, right? For me, having lived a quarter century in Eastern Mass, the level of coordination here that I saw among the different actors, you had, the Amherst Chamber raising $320,000 for local businesses. So all of those have an impact on our businesses to continue to stay resilient, to continue to survive this pandemic and then thrive through this moment as we learn how to adapt and how to become much more resilient. So I'd say the college has also benefited from that as our students are entrepreneurs, and they also benefit from the entrepreneurs of businesses in the area, and also from the services of the United Way. So it's been a great collaboration.
Fantastic, thanks. Collaboration is certainly extremely important. That's part of one of the points of doing exercises like this, is to get people under the tent to talk about ideas and hear inspirational stories. Every nonprofit has a constituent base. They have membership. They have a service community that they worry about during times of crisis such as this. Yves, if we might stay with you, what has been the greatest impact on your service community, and what do you envision being the greatest needs for your constituents moving forward? I know as a higher ed institution, some of that may be obvious, but what keeps you up at night when thinking about your constituents?
Yeah, so this is an important time because not only are we in the middle of a pandemic, but we're also in the middle of an economic downturn. So what we are seeing is that as people are losing their jobs, because some jobs are becoming obsolete, right? What we can move to be remote, to be done remotely, is being done remotely. And there are certain jobs that will not survive this. So as we are seeing an increase in the number of people who are unemployed, Massachusetts continues to lead the state in terms of unemployment rates, and our region seems to have some of the higher unemployment rates in the state. People are looking to be reskilled, to be upskilled, looking for the skills that will allow them to transition to the jobs of the future and to the jobs that can be done remotely. My light just went off. So what we are seeing is that our constituents want that from us, and they want us to be able to provide support. So we are reorganizing ourselves to be able to do that. We are also seeing students as we serve a range of students, from those who are very well heeled and very academically prepared to those who are experiencing food and housing insecurity. We're also seeing that constituency having different needs. And we are seeing, to some respect, in the health sector, we've been asked to have some of our nursing faculty go back into the field and support. So we've been able to do that, which has helped us to get some perspective in terms of how the disease is progressing, how people are experiencing it, and also how our healthcare industry and our hospitals are handling and responding to that. So in some ways, it is helping our nursing faculty to be even better as they share those skills, they share those new knowledge with our current nursing and other healthcare, EMT, EMS, and other students, because we've had those faculty members go back into the field. And we also have students who are right now in the field doing this kind of work. So it's been one of those situations that has, one, forced us to learn a lot more, respond, and also be part of the response. And I will give one shout out actually to the Community Foundation of Western Mass. They have just been really phenomenal in supporting us and also a range of organizations, and not just responsive, but also they've been very proactive in terms of saying, okay, what are the needs? And the needs are financial, the needs are technical, and the needs are people delivering food, people making phone call, assessing different community members' needs, especially those who are most vulnerable. So we've been able to contribute to that, which has also helped us in terms of becoming a better college for the community, because community colleges are deeply rooted in the community. 80 to 90% of our students, of our graduates, live right here in Franklin and Hampshire counties. So all of this has been a great learning opportunity for us and the constituencies that we serve.
Okay. So Eva, I like you're talking about the pandemic and the economic downturn, because that's exactly how I think of it, but I use the terms clinical and community. And actually I want to add a third, which has been talked about a lot recently in this political season, which is health equity issues. And so we, in terms of clinical, our real concern is that people delayed care for a very long time. I mean, you heard the stories about people not going to the hospital when they had heart attacks, people being very concerned about getting care, which means that now there's this huge group of people who need to come in, who need to get their immunizations if they're children, who need to get their diabetes managed. And so we're really focused on that and on making sure that our community is as healthy as possible and that we're getting them in the safest possible way. So if people can be seen through telehealth, we're seeing them through telehealth. But if they need to come in, then we're bringing them in, and for dental, for all of our services. All along we were doing urgent and emergency care in person, but now we're doing all of that maintenance care that wasn't happening, and so that's the pandemic clinical piece. In terms of the economic downturn, I want to echo that the Community Foundation of Western Mass was amazing. We were able, and this is Amherst specific, they gave us funding specifically to pay housing, electrical, any bills of patients or anyone in the community that we knew about, particularly people, and this is a health equity issue, who didn't have access to economic supports because of their documentation status or because of language barriers. And so our community health workers were out in the community, knew who those people were, would we would send checks to the electric company or to the landlord that we were able to fund directly through the community foundation. And so their recognition of us and all of our colleagues in the community as the people who know who needs help, and that they could use us as 100% pass through to identify who those folks were and make sure that they got that money. And they've given us another grant to do the same, and we're continuing to do it. And that those monies are really being funneled directly into the community, into the hands of people who need it. We've developed all kinds of ongoing collaborations, but specifically geared towards the impact of the economic downturn. So we're really proud and happy to be working with Cooley Dickinson on the Mass Up program, which is creating a food policy council for Hampshire County to really talk about food security and helping support through both existing grants and new grants during COVID to support Healthy Hampshire with farmers market, mobile markets in Amherst and in the Hilltowns and other communities to get people fresh food, and recognizing that those needs are only going to continue to grow. And then the health equity piece, again, it's our mission to make sure that everybody has access to healthcare and to all these other supports. And so we, like many organizations, are really needing to buckle down and recommit ourselves to health equity for everyone, regardless of not just insurance status, race, ethnicity, and geography, and make sure that we are really fulfilling our mission around access to health and well-being in the community.
So I'd like to just echo one thing that Yves said just a few minutes ago, which has to do with being proactive. And that's another component is as you sort of do this quick assessment of what your strengths are as an organization, you want to see if there's some gaps that you can fill as quickly as possible. And one of the gaps that we identified early on was the fact that there was this sudden need for volunteers at the same time that there were people who wanted to volunteer. So your traditional source of volunteers for a lot of organizations dried up. People who were over the age of 65 were reluctant to come in because of their own health. College students were no longer in the area. Parents were suddenly at home taking care of their kids. And so suddenly you had this need for volunteers and you had a need for people who wanted to volunteer. So we quickly stood up a database of those opportunities that people could take advantage of. And it was sort of a mix and match type of thing, which worked very well through that first wave of need. Also really able to find volunteers for organizations and for things that were needed at that time. A good example is the Northampton Chamber that was at the shelter, which was at the high school in Northampton. And there were all these wheels in motion. It was all ready to go, except that they lacked the volunteers. And the method that they thought would work for finding volunteers didn't work. So we offered to reach out, and over the course of a weekend, we're able to find about 90 volunteers, which not only helped to stand up the shelter, but to keep it running for the duration. So again, quickly assess what your superpowers are, however you want to term it, or your strengths, and figure out how you can parlay that into something that could be helpful under the circumstances. There's no doubt that in terms of impact on the region, the economic impact is huge. Before COVID-19, it's really helpful to understand that over 40% of our neighbors were either in poverty or near poverty. Poverty rate is around 12%. The near poverty rate is over 30. So before COVID-19, this is really hard to believe, over 40% of our neighbors were already in that category. And that's a category that United Way really focuses on. Yes, we're here for all people across Hampshire County, but the truth of the matter is 90% of all our funding and support goes towards poverty and near poverty related issues. Needless to say, we see that only on the rise. All we've seen since this has started has been a far greater need for shelter and for food, and we've seen that with our partner agencies. A good example is East Hampton Community Center, which has suddenly seen 20 to 30 new families a day. 20 to 30 new families a day. Or It Takes a Village, which is a nonprofit up in the Hilltowns, which supplies everything from diapers to food to used clothing, and they saw an increase, a remarkable increase of need that was 2,400% over the course of a few weeks. So that has subsided a little bit as the weather has gotten warmer, and more of the shelters aren't needed, but that traditionally happens. People move outside, as you can imagine, come fall, come the flu season, come the cold weather. Those needs, as we project, are only going to skyrocket. The other thing that we've noticed is that there's an increased need, no surprise, on behalf of nonprofits, because more is being asked of these organizations at a time when, for a lot of organizations, less is available. So there have been studies done by Philanthropy Massachusetts across nonprofits in the state, and they've seen a big drop-off in terms of donations, in terms of volunteers, at the same time that the need is going up. So there's obviously a stress there, which is why we're not only there for the community, but we're trying to be there more and more for the nonprofits. Those are the two big things that we see need addressing.
And sorry, I just realized as you were talking, thank you, John. And yeah, your work has been phenomenal in this arena. I wanted to talk about two other needs in the community that I think our colleagues in the nonprofit world are really doing a wonderful job, and we're supporting whatever we can. We are seeing, as a result of this, a big increase in domestic violence. And that's something that I think, people have been hearing about. We're the domestic violence provider in the Hilltowns, but our partners at Safe Passage and Nelquit, and I think everybody has really been working really hard to address those issues. And I think the economic downturn, I think it's not going to go away quickly for a whole host of reasons about isolation and economic challenges and kids being home. And the other is, oh my goodness, I just blanked on what the other one was. Sorry.
Childcare?
Really important, but yeah. So I just wanted to make sure I mentioned that as something that's really important in terms of what's happening.
Yeah, thank you. I think we touched on communications a little bit, but I just wanted to give the opportunity if anyone felt they want to talk a little bit about how, all these monumental changes that are happening with your organizations, a lot's going on behind the scenes. Your students, your faculty, your patients, your members may not understand all of these changes. It may change how they communicate with you, how they receive information. How are you communicating these operational changes to everyone from staff to clients to donors, your stakeholders? How has that changed kind of your day-to-day operations? John, Yves?
Well, I'll comment on it. I think it's really difficult right now because it's such a fluid situation for us. So, for instance, this morning we just had our finance committee meeting, and it's hard because it's such a fluid situation. Things change from day to day, and I would say as leaders, we have a responsibility to communicate communicate things to folks, and also to make decisions based on empirical evidence, right? Because we do have empirical evidence based on the spread of the virus. And at the same time, make them based on the people whom we serve. All of us here on this panel are service organizations in one way or another, though our industry differs. So it's to let people know that what I said to you last week may change today. It was true last week, it was true 2 days ago, but today it's not true. And so I think that's important. And sometimes that can be hard for folks, and to also communicate with a level of empathy and a level of sympathy, because people are losing loved ones. They are scared about their jobs. They are scared about people who contract the virus. They are scared about their family members, their loved ones who are at higher risk compared to others. And they are scared about school reopening remotely, and we are working adults with with children whom we are going to neglect in some way or another, because it's hard to be a working parent and also caring for your child and homeschooling. I can tell you that failed miserably in my household with my daughter. There was no homeschooling happening. If anything, it was please be quiet because I'm on a Zoom all day. So I think, approaching it that way, and also understanding that because we are remote, because we are physically distant, picking up the phone, that old technology called a phone, and the house phone, for those of us who do have house phones, people are using the house phones. And in rural communities where we tend to be more disconnected, the Hilltowns, especially during the winter, where people went through this whole period without seeing another person, very likely, except for when you go to the scary adventure called the grocery store, right? And we were all scared initially, hoping that we wouldn't get sick. So it becomes, communication takes another form. And it means much more frequent communication. It means picking up the phone, and it means having Zoom social hours, and not just the regular business meetings, but to say, hey, let your air out, have a glass of wine, and let's just commiserate about what's not going so well, what's stressing us out, and providing a sense of community, and a sense that things are going to be okay, because that's part of our job as leaders, which is to bear a lot of the hard decisions, a lot of the stresses, and to give people a sense of hope. And I would say that, I saw that in the Amherst Chambers, I Am Amherst, and the BID, the Business Improvement Districts, the way that they've been keeping our spirits up, and just the little things that give us a sense of normalcy. And I think as leaders, that's what we need to give to folks. That's what we need to give to our constituencies, that this is bad. Yes, it's bad. We recognize it, but it isn't forever, and we're here for you.
Fantastic. Thanks.
Can I jump in? I want to say, Alex, you listed all sorts of stakeholders. I think one really important group to communicate with, which was who I was talking with constantly in the first couple months, is our elected officials, and particularly our legislators and our congressional delegation, because I just saw a question popped up about financial support, and I think that it has been critical that we have a phenomenal delegation on Beacon Hill in this area. Senator, if I try to list them all, I'm going to miss somebody, but certainly Senator Comerford and Representative Blay and Representative Dom have all been just so attentive and so willing to help. And so communicating with them regularly about what's going on, what help we need, where we need intervention, and then communicating with our state partners, and spending a lot of time talking to our congressional delegation, Congressman McGovern, and for us, Congressman Neal, was really critically important through this whole thing, because I think there's lots of communication we need to do, but this is one of those externalities the government is designed for. We need them to be able to step in and help all of us with managing something that's bigger than anybody. That's a global pandemic. So I want to just make sure we did a call out for what a fantastic job all of them did as well.
I echo that. The representatives really are there for us. And as a matter of fact, in the past, I've often heard that they want people to reach out more. So if you're not used to reaching out to this group of people, in no way should you shy away. They're more than welcome to talk with you and any details and concerns that you have, and they actually welcome it. I would also add in our area, Lindsay Sabadosa. I mean, the whole delegation has truly been phenomenal. And I also totally agree that you want to pick up the phone. There's a lot that can be accomplished through e-newsletters and email, but frankly, there's not much that can be just picking up the phone and talking to people. And I find at this time, more than ever, people really want to talk. They're ready to talk, probably, and they have the time. So I know that for us, that can be hard to imagine, because a lot of the people, I think, who are on this Zoom meeting are probably overwhelmed with the number of meetings and responsibilities per day. But other people are stressed in other ways and actually have more time. And they always appreciate the personal outreach. So that's something that we have been doing with the partner agencies. That's something we've been doing with our volunteers. And it's certainly something we've been doing with our donors.
So since we all were naming names, I will put out there, Rep. Paul Mark, Susanna Whips, and also Representative Hines, Senator Lesser. They've all been very supportive. So I think that completes our delegation. If we missed anybody.
Minnie Pignatelli. We cover most of Western Mass, so there are a lot of us. Yes.
I'll shout out to Minnie Dom and did we say Comerford? Okay.
Yes.
Okay.
I think you did say that, Eliza, right? Yeah. Okay. All right.
Did you say?
I don't think we left anyone out.
Very good. Well, thanks. Very thoughtful responses. We're about 40 minutes in. I think we have time for one or two questions from me, and then I'm going to kick it over to Kevin to maybe field some questions from our chat room. We've had quite a few so far. So, just shifting a little bit, I'm going to kind of skip ahead a little bit and maybe talk about, how can organizations, particularly nonprofits, either increase your capacity or kind of think outside the box to become more adaptive or creative so that they may best weather a crisis such as the one we're in?
I'll just say that I think that John hit it when he talked about best practices and not reinventing the wheels. I mean, that's not a very creative response, but I think in some ways that there are people doing creative things every day. And we found it just incredibly helpful to have those networks to reach out to and to say, how did you deal with this? How did you deal with that? And sometimes you have to then take that and make it work for your region. Being in a rural area, it's a very different reaction sometimes than what other people are doing. But I think that's a really critical piece of it is the thing that sustained me the most in the first month of the crisis is we're not alone. Everyone is dealing with this. Yeah. We don't need to reinvent the wheel, and we don't need to do this alone. We need to all do it together. So that's what I would say.
I would say that the number one thing is don't be afraid to ask. Ask for help, ask volunteers, ask for money. People at this point really want to help, and they're willing to help if they can. And sometimes there can be a tendency, what I've heard over and over, that people want to shy away from it. They're like, look, it's a very difficult time. We're assuming that people have enough pressures. The last thing they need is me calling and asking more of them. But I have to say that has not been the response from anybody that I've asked. Anybody that I've called, anybody that we've emailed, anyone that we've lettered, they are all willing to help as much as they can. So as long as you're clear and articulate about what it is that you want, please go out and ask for it.
I would add to what my colleagues have said and to also say that, yes, in some areas, we do need to reinvent the wheel. So it's the coexistence of learning from others and also realizing that the world is shifting and is changing pretty dramatically. When we talk to businesses and we hear how they are responding, and Claudia is one of the members, and I see John Howland is also here from Greenfield Savings Bank and our Future of Work Advisory Committee. And we are hearing how they are pivoting. I mean, I think when you look at the way that Greenfield Savings Banks responded to this very early, and as we talk about communication, I think they are probably one of the best models in our area in terms of keeping that communication very consistent, and for their constituents to say, hey, we can help you with filling out the PPP applications. We can help you with delaying your mortgage rates. We can help you with all of these. So they are doing business differently. And I think in higher ed, we tend to be so married to tradition that seeing that we are changing everything creates a sense of panic often. But what we've seen is that in a matter of 2 weeks, we took all of our instruction, all of our operations, and put that entirely online. So what that demonstrated to me is that we do have the ability, when we have the will, and when we are forced to pivot, to change very dramatically. So why do we have to wait for crisis to force us to do that? I think as we are looking at the way that the fourth industrial revolution is changing the world, the way that technological changes are permeating every single industry, we have to think about what implication does that have for teaching and learning and the jobs for which we are preparing our students. When you look at the jobs that existed 30 years ago, many of them exist in a very different way. We also have seen very new jobs that are coming to the market. And as a result of this, we're seeing also other new jobs coming in. And then I will also add that I don't think this is the last global pandemic that we're going to have. We should prepare ourselves for more global pandemics. We should prepare ourselves for more environmental disruptions. With climate change being what it is, we've already seen with the succession of hurricanes that we've had in the last 5 years, how disruptive it's been for other parts of the country and other parts of the world. I think we need to be very worried about that. And I think also there is, social and racial changes that we need to be very aware of. I think when you look at the Black Lives Matter movement, when you look at the greater call for more equity and equality across the country, that you have people across the globe coming out during a global pandemic, what it says to me is that there is a heightened sense of awareness, consciousness around these issues. And as our own country becomes more of a plurality nation, I think we can expect to see these sort of things happening on a regular basis. And economic disruption, I mean, let's face it, we are becoming increasingly more inequitable when you look at the economic inequities, when you look at the increasing wealth gap and how that is exacerbated for communities of color. I think those are things that we all need to be aware of. And the context, the external context in which we are doing our work is changing pretty dramatically. So that means there are things we do differently. There are areas that are priorities that we need to focus on differently, and the tools and the jobs for which we are preparing students, especially in rural areas, because I do think what this period has done is accentuated some of the technological divide and the rural divide in regions for the haves and the have-nots. So those are all of the things that I think we all need to be much more mindful of, and they will have implications for how we do our work and how we are impacted and impact others, including the environment.
Well said.
I think what's happened under the crisis is there's a lot of issues that we've known that we've needed to address. A lot of organizations have said, we know we need to address the racial issue. We know we need to be more efficient. We know we need to be more effective. We know we need to be more online. And these have been conversations that we've had for years. And indeed, last year, our United Way put together a strategic plan for the next 3 to 4 years to address some of those things. And then suddenly, we've had issues bubble to the surface or storm to the surface in the last few months. And these things that we thought we would be addressing over the course of several years are things that we're addressing in the course of several months. Everything has been sped up. So organizations need to be flexible. I mean, they need to be able to look at these situations and say, these are all things that we need to address. We're just having to address them a lot more quickly than we meant to. Also, look for opportunities to be more efficient and more effective. This crisis sped up our conversation, for instance, with United Way of Franklin County about a potential merger. These were things that we'd kind of talked about on the periphery for a year or so, and then suddenly realized that this is an opportunity to move on this. I think one of my favorite sayings is, don't waste a crisis. Rather than shying away from a crisis, if you can recognize it, that this is an extremely unique time to start addressing things that you need to address and bring them to the surface. You also don't want to appear tone deaf. So whenever you have your communications and your outreach and you look at your mission, under these circumstances, it is imperative that you address issues, how you relate to COVID-19 and what that means to the community, and also around racial solidarity. It is imperative that you look at these things within yourselves as well as the community and figure out what that means for your organization vis-a-vis the community. So don't waste a crisis, don't appear tone deaf, and be prepared to speed things up. I also personally would advocate, if you don't do this as an organization, that you start some financial investments on the background. One of the things that we've seen with a lot of nonprofits, there's ones that are failing, are those who did not have investments and do not have the funds to bridge a difficult period, it's very difficult. And I know that we are here for the community and we're here to give back, but it is also imperative that we look out for our own survival so that we're around long enough to continue to help people. And I do think we've given some shout out to the banks here also, and I think all the banks in the region really deserve a lot of attention for how they've stood up. I think some of the most incredible support has come from People's Bank. It has come from Greenfield. And I think that, again, the leadership that, for instance, John has shown with the ads that you've seen in the paper are a perfect example of what any organization can do to say, look, this is how we give back to the community, and this is where we need to go.
So I'll add to the shout outs to the bank, Greenfield Cooperative Bank. I also have to say has done a phenomenal job throughout this, supporting not just the businesses, but the individuals also.
Fantastic.
I want to also echo what you've said about this isn't going to stop. This isn't, we will continue to have these kinds of crises, and the fatigue that we're seeing after 6 months, it's just going to be something we have to figure out how to maintain ourselves and sustain ourselves. And so to that, we're lucky as a healthcare institution, and particularly as a federal, essentially a sort of quasi-federal entity, we were required to plan. We had a continuation of operations plan in place specifically pretty much for pandemic that we had already written saying, okay, we have to close sites. We won't have staff. How are we going to deal with that? And it was really theoretical, and we sort of thought, oh yeah, we've checked that box with having that plan on some level, but it was critically important to have it. So I think not feeling like, okay, we got through this and we have a plan and now we can stop. I think it's continuing to think about, okay, what's the next challenge going to be? I think environmental crises, I think environmental refugees, I think is the term people are using, is sort of what migrations are going to be happening. Are people going to want to move to the hill towns because it's 10 degrees cooler and we're not going to get flooding on top of most of the hills? What is that going to do in our communities? And we have to work with our municipalities. We have to work with our colleagues at, in business and in other nonprofits to really think about what does that new future look like. And so I think planning, it's hard to take the time, just like it's hard to make investments and things. It's hard to take the time to plan for a future when you feel like you're in crisis now. But I think we've seen what strengths we have in crisis. So we need to build on those. And we need to realize, wow, our staff are really good at mobilizing, making decisions quickly. How could they apply those skills in other contexts?
Thanks, everyone. That's a really good segue into my last question. And when you're thinking about your organization or your response as a leader to this crisis, what are you most proud of, or what are the kind of the silver linings you'll take with you into the future? Eliza, you want to stay with you?
Sure. I'm not muted, so I'm an easy one to start. So I want to say first, we talked about our legislators. I was really impressed with the state. So this is what I'm proud of in my organization, but I'm proud of us as a state. The response from the state, and grant you, we've been asking for years to address the fact that Massachusetts was almost last in the nation in terms of telehealth reimbursement, but they pivoted on a dime, and we now are right at the forefront in terms of understanding and paying for telehealth services. And so I think that's a huge silver lining, because we hadn't really developed those systems because we couldn't get paid for them. And now we can, and so we're developing them really, really quickly. And so that's a huge silver lining that we can expand. I mean, in behavioral health, I said that we kept 100% of our capacity, but now we were running out of space to put behavioral health providers. And so now we'll have more space for in-person because, well, at the moment 100%, but soon, some percentage of our visits will be on, through telehealth. But so again, kudos to the state. They also recognize the community health centers are part of the safety net in the state, and we're the largest primary care system in the state, and have provided us with tremendous support, recognizing that if the community health centers aren't there, who else is going to be providing those public health supports? And I would say, I think another silver lining is recognition that public health is important. Public health is not something that had been at the forefront for a long time. And so I think that's been huge. And the thing I'm most proud of, as I've said, is how quickly my staff was able to mobilize incredibly committed It's a risky job. People who were like, yep, I'm in the clinic every day and I'll wear my PPE, but I'm going to serve these folks. And obviously we are not in Hampshire County in the middle of it in terms of how severe the crisis was compared to my colleagues in the eastern part of the state and in other states. But we didn't know that at the beginning. And so, you know, I think what people did was phenomenal, and they deserve just a tremendous amount of credit.
Thanks, Eliza.
Yeah, I would jump in and say that, you know, when I'm really just proud of everyone who I've seen in the community who's stepped up through all of this. This is a very difficult period right now, and there's a lot of people that are exhausted, and there's a lot of people that are tired, there's emotionally, physically, and that's on top of people who are sick. But this really is a remarkable watershed in the history of our country. And I think what keeps me positive, my concern is in the short term about how much damage will it take to get to a better place. But I'm firmly committed that we will get to a better place, and that we are at this remarkable time where we're addressing issues that should have been addressed a long, long time ago, but we're finally there's a social consciousness. It's been long in coming, but it's here. And the response that we've seen, whether it's from my staff, whether it's from the board, it's from the volunteers, certainly from the donors, has been remarkable. I mean, people have not shied away. People have stood up across the board in small ways and in big ways to help out. And the local response has been incredible. Yes, the state has stepped up, but there were also things that really demanded a very local response to be successful. And those people have done that. And I'm firmly confident that they will continue to do that. This crisis is not something that's going to go away. Even if we get a vaccine by December, it's not as if suddenly everything's going to be poofed back to normal. This is something that we're going to have to be dealing with for a while, and there have to be systemic changes that have to occur now in order for things to get better later. But based on what I've seen so far, I'm not saying it's going to be easy, but it can get done.
Thanks, John.
Wow. I'd say my colleagues have said so much of what I'm thinking. I would say the advocacy from our delegation has been just exceptional, I think, and also highlighting the disparities between the East and the West. And, you know, Franklin County being the poorest county in Massachusetts, bringing some attention to what is happening here, and I think has been just phenomenal. So I'd say that as one of the silver linings of this, that people are paying attention to our part of the state and realizing that rural poverty, rural areas exist in Massachusetts, and there is such a thing as rural poverty, and some of the inequities. That's been great. I think what I appreciate the most in our area is the sense of humanity. Our humanity has really shown through this period. And both Eliza and John have talked about the donors. The people who are able to share whatever it is have stepped up and to say, this is what we want of our community. This is how we can support our community. I've been very grateful for that, because we do have students who struggle with food and housing insecurity. And what I have also seen of our leaders across the board, including everyone on this call, because we recognize so many of the names, is the courage with which people have led, right? This has taken a tremendous amount of courage, a tremendous amount of willpower and empathy, and we've all been willing to do that. And I would say to the municipal leaders and to the public health folks and to the hospital leaderships and the folks who are working on the trenches is the management of this public health crisis. When you look at our rates in this area relative to the rest of the state, relative to the rest of the country, and even the governor, and some of the ways that we've managed this, when you look at other states, you think, oh gosh, things could be so much worse. And we've done a really good job at this. So I think, you know, the leadership from the very top down to the everyday person, we have shown a level of care and citizenship and stewardship that I think can be a model for elsewhere. And the focus right now on equity, on the most vulnerable in our area, populations in our area, and the focus on resilience and what we are learning from this moment to help us move us forward, I think has been extraordinary.
Can I jump in? I thought of a state representative we forgot.
Oh,
Absolutely.
Dan Carey from East Hampton and Southampton.
okay.
Thank you to Dan.
You know,
I think we now have them all covered, right?
Yeah. Next time we'll have a checklist.
Right.
I'm gonna in a minute here gonna turn it over to Kevin. He's gonna field a couple questions from our chat room. I want to thank all of our participants, and I want to thank everyone who's been waiting for their questions to be answered online. You know, we've got 31 people here on the call, and they've stayed in there strong. So I want to thank everyone for hanging in there and hearing some great anecdotes and getting some great advice. You know, in the spirit of collaboration and focus on community, I did want to mention that our organization, Prosper Nonprofit Advisors, is offering free consulting to all chamber members that are on this call. So please keep your eyes out in your inbox. After this call, we'll be sending information on how to sign up for that consulting. With that, I will turn it over to Kevin. Kevin, are you here?
I am here, and I just wanted to get to the Q&A session, but before we do that, I wanted to thank our incredible panelists for some amazing insights. I've had a number of people contacting me privately saying this is fantastic, so I really appreciate your participation. I really appreciate the Amherst Chamber and their partnership on this. And of course, I greatly appreciate the sponsorship by People's Bank. This has been phenomenal, and we're really excited to be a part of it. So with that, I've gotten a number of questions in the chat board as well as posted to me individually. I think I'm going to start you out with one of the big ones. John just spoke about systemic changes that are coming. One of our audience members would like to hear the panelists answer what exactly those changes are and what is the role of nonprofits in bringing about those changes.
I think the most important systemic change is the focus on systemic racism, and that needs to be a lens through which, and certainly the Massachusetts Department of Public Health has actually explicitly stated this, that our work needs to be done through that lens. We need to recognize the implicit bias in all of our institutional, and systemic systems, and healthcare is no different. So I think, the first thing when you say systems is, I think, systemic racism. There's lots of others, but that to me is one that really needs to overlay everything we do.
I also think we need to think about the intersectionality. So to build on what Eliza has said, because we know that there are populations that are suffering and will continue to suffer much worse from the from the pandemic and the economic downturn. So when you look at women, you look at folks over 60, when you look at folks within certain, the bottom two economic strata, they are faring much worse. So it's looking at these things and the intersectionality. And I think also one of the systemic changes that we're going to have is around work. We already saw that there was significant changes happening. If you look at the Oxford Research Center, or you look at the amount of work that the I think it's the World Economic Forum has been doing around the future of work, around the jobs that will cease to exist. What we're seeing is an acceleration of that, right? And that's going to have an impact for the real estate sector. Will people really need huge businesses? No, they will not. Now that we are learning to work from home, I think a lot of the costs of maintaining an office will be passed on to the employees, to the workers. So we need to adapt for that. And what does real estate look like? What do these big buildings look like? And so I think that's also going to have an implication, especially for cities that have huge tall skyscrapers, right? What's going to happen? And already we're seeing telehealth being accelerated. We're seeing a relaxation of government policy and regulations around that. I think we will continue to see some of those things. And we're also seeing a number of folks who are moving from cities into more rural areas. So the repopulation of the rural areas, I think we can continue to see that beyond COVID-19, that folks are going to say, you know what, I came here to escape the city, but I actually like the quality of life over here. So I think those are all things that we need to be prepared for, and some of it will be good and some of it will be bad. And as a society, I think with regard to the workforce, again, we need to figure out how will we protect and help reskill, upskill our most vulnerable populations, the folks who don't have access to technology or reliable broadband and internet to be able to work from home, the folks who are unable to purchase a home computer and a printer to get work done, and the folks who are impacted by childcare. So I think we can expect a number of systemic changes across areas, and it's best that we not look at them in isolation or as vacuum areas, but really, as Eliza was saying, as interconnected systems.
And I want to add, I want to just quickly, sorry, John, just jump on the technology piece. As someone who doesn't have cell coverage at home and is supposed to get high-speed internet within the next 2 months, I'm hoping, I've had to come into my office because I cannot work at home. Yeah, exactly. And I want to make the point that that is a big rural piece, and I'm asked to talk all the time about technology in rural areas, but my colleagues in downtown Boston have plenty of patients who, to Yves' point, can't afford, don't own a computer, can't afford it. We have lots of patients who can't do behavioral health sessions with us because they're on a phone that's run out of minutes. So I think that technology systems, I think it's just, it has to happen and it has to be universal.
Hear, hear.
Yeah, so there's no doubt that we live in a caste system. It's usually not a term that's applied to the United States of America, but the truth of the matter is it's a caste system. And again, as that realization is, the light goes on for more and more people, that's going to have to be addressed, all the permutations that grow out of that. And it's tied in with economics. Again, just to remind people, before COVID-19, over 40% of our neighbors were in poverty or near poverty. You've got to be kidding me. Before I was in this job, if someone had asked me what that percentage was, I would have guessed, I don't know, 15, 20%, but over 40% closing in on half of our neighbors. That is inexcusable for a country like ours. So that is something that we're going to have to look at because it sure isn't getting better over the next few years. So there are also things that are within our region that are going to be very interesting to take note of. We are a region that's highly dependent on educational institutions and on large nonprofits, especially with healthcare. And education, as we know, is changing immensely. And I've seen articles on both sides. A lot of this has not played out entirely at this point. Educational institutions, there's a lot of fear around them in terms of them going away, and not just the institutions themselves, but the impact that they have on the local communities. It's huge. It is really the fuel for a lot of our local towns. And so it's something we need to pay attention to. There are other people who come out and say educational institutions will always be around to a certain degree. That's not to say that there isn't going to be struggle. There is going to be struggle, but educational institutions are where people can come together for the sharing of knowledge and the advancement of humanity. That piece, that desire to come together is not going to go away with COVID-19. I think that once we have a vaccination and once we're through the social distancing, people are going to rush and flock back to those places because that's how we're built. That part's not going to change. What's going to happen with the rural areas is hard to say. The rural areas, in my opinion, I know they've been shrinking in numbers by double digits over the last generation, but at the same time, that could reverse right now with COVID-19 as people are looking to get out of the cities. We really don't know. So that's all to say that I think one of the big things we need to prepare for is uncertainty. We don't know. We live in a world where we love certainty. We want to know that our job is going to be there tomorrow. We want to know that the income is going to be there. We want to know that it's going to be safe for our kids. We want to know all those things. And the truth of the matter is, in a time of great change like the one we're in right now, we don't know. So learning how to live with that uncertainty to a degree that we're not used to is paramount right now.
Well, these are great insights and very impassioned pleas for our society. So thank you very much for that. Another question we received is what funding resources are needed to sustain your organizations during this time, and where might that come from? And how confident are you that needed funding will come through to nonprofits?
So that's a really hard one. I'll just use our organization as an example. We ended last year on a very strong note. We ended it ahead of not only what our budget was going to be, but what we thought it's going to be for next year. But as late as May, I was talking to my board saying we could be down $150,000, right? So as late as May, I'm delivering this potential dire report to the board. Suddenly we get into July and we're up 80 grand and we're in a great position. And that's all wonderful. But at the same time, that's no guarantee whatsoever as we head into the new year. So we have contingency plans that say, we're planning for being everything from 20% down to being up 50% because we're going to be looking for more funding based on the number of requests that we're getting. Again, it speaks to that desire to be flexibility. I would highly encourage any organization from a financial standpoint to look at different scenarios, everything from being down 25% to being up 25% if you decide that you're going to go out and do all the asking that you need to do. You're going to have to look at the full range.
I agree with John. I think we do need to prepare for multiple futures. There is a lot of uncertainty, and adaptability, agility is the name of the game. We don't know what things will be like, and I think we also need to have multiple contingency plans, multiple scenarios, and also demonstrate a level of entrepreneurialism. And the world is changing. So whether it is, cost cutting, revenue generation, our communities need us, and each one of us here serves a critical constituency group here. And if we didn't exist, we can't imagine what our communities would look like without our critical anchor organizations here in the area. So I completely agree and have nothing else to add to what John has said.
And I would agree as well. I think one of our challenges is, the outpouring of support over the last 6 months has been overwhelming and incredible, and has certainly kept us, where we are now is not where we thought we were going to be at the middle of March. Like things seemed really dire, and we're definitely better off. However, we have no idea, if we get another surge, we're back down to 20% of our revenue or 30% of our revenue. As we build our telehealth systems, maybe not, but so I think we are, again, I would echo both of my colleagues, planning. We're doing scenarios up through 2022 to say, okay, this is how much cash we see coming in. If our revenue is this, what will it look like? If our revenue is this, what will it look like? And trying to get the message out to donors and other people that, we so appreciate all of this support. But the uncertainty, which I think is the other, I want to be hopeful here as to Alex's point, but there's just so much uncertainty, and how do you operate in that context? And I think the only thing you can do is as Yves says, plan for every scenario that you can conceive of, so that you can then figure out what will your response be.
These are phenomenal answers, and we also have some very discerning and astute audience members asking some astute questions. Another one that came through was, how do you address some of the rumors and fears as budget implications arise about the health of your organization and workforce? What processes are you using to address these fears, and who is part of those conversations?
I would say communication is your best antidote to rumor. Making sure that people know where you are and what's going on, the good and the bad, because if they know that you're telling them the bad, then they know that you're not hiding it. So I think that would be my short answer.
I think fear it's human, right? And the environment that we are in right now engenders a level of that. If we don't have a healthy dose of fear, then I would say there's something wrong with each of us. The external environment isn't exactly rosy right now, but I think to be courageous, to look at the long term, because I do think most of our organizations will survive this fiscal year. We have things in place, but we have to look beyond the current year. We have to look beyond, as I had said before, we thought we were preparing for a 2-week break. And then we realized we had to look beyond that to the end of the semester, and beyond that so I think building resiliency is one of the intentional byproducts that we are building within each of our organizations. And I do agree with Eliza, communication. And I think also for folks to realize that leaders are people just like them. And as things have been unpredictable, we are reacting to some extent, and we're also being proactive to other extent. And as much as people want certainty, they want definite, concrete answers. Let's be realistic. A lot of that is not possible right now. But what we can do is help people cope through with the change, with the uncertainty, and to also have a sense that we are all in this together, and we all care about our communities and our organizations, and we will surmount this because as a human race, we have surmounted other similar and perhaps even worse challenges.
Yeah, it's imperative that you be transparent as an organization. I would not, transparency doesn't mean that you take your stakeholders on every up and down of the organization. I would refrain from doing that, but you do need to be transparent about what you're doing. Nobody's going to get upset about the fact that you don't know the answers right now, because nobody knows the answers, but they will hold you accountable if you're not preparing. So be free to say, I don't know, but quickly respond that you are looking at different scenarios and you are doing the best to your ability to fight, to prepare for things. The other thing I would say that's important is remind people that you're willing to fight for them. We are organizations that are here for different communities, and people want to know in difficult times that they have got someone who has their back. We need to remind them that we have their back.
Great insights. I've got two more questions if we have the time. One of them, one of our audience members asked that we've talked a lot about collaborations with other nonprofits, but has the shift to virtual service delivery leveled the playing field? And how will you adapt your brand positioning and continue to differentiate among your peer group?
I don't think it has leveled the playing field. I mean, I think if anything, it has exacerbated the challenges. When we have people whose jobs cannot be remote. We have people who are adversely impacted. You look at our grocery store workers, you look at people who are cleaning buildings, the folks who are engaged in this kind of work. They are putting themselves at risk every day for us, for our public health, in service of our communities. I think there are lots of people who don't have the money to buy the technology. And if anything, this pandemic has made evident some of the fissures in our economy and in our democracy. Some people are able, some people are not able, some people have health insurance, other people do not have health insurance. Some people have dwellings that allow them to pivot and to work from home, and other people don't. And some people are able to afford childcare while others are not able to do that. Some people are able to take some time off and care for loved ones, and other folks don't have that luxury. And as we look at how this pandemic has adversely impacted certain groups, I would not say that it has leveled the playing field. And you still have people in more urban areas, and even here in the Hilltowns and elsewhere, people who do not have a car, who have to take public transportation, people who are driving those buses, who are exposed to whoever comes. And even with social distancing, when you're driving a route and people come up, you can't tell them to get off the bus. So I think there are some who are better off, and there are some who are financially doing very well. We have seen the level of wealth for some groups, for some folks, has increased exponentially during this pandemic. And for others, it's been the exact opposite.
And I would agree. I think the word that came to mind immediately is community, that people really value the connections that they have. And while things may be available through technology in a way that they weren't, I think personal connection and knowing the organizations that you're working with is critically important. And in healthcare, I mean, obviously there are a lot of services that we do that you need hands-on that can't ever be replaced by technology. We're working on where that line is, but I think that there are things that can't ever be outsourced to someone else. So I think that's part of my response is I think that there's always going to be that connection. And quite honestly, there's a lot of things that a lot of the nonprofits do that nobody's competing to do. It's not, these are not things that are well paid. These are not things that anybody, we do this out of a sense of mission. And so and they can't be done anyway. You can't get food to people except in person. You can't get, help people with housing, et cetera, except in person. So I think it really depends on what service you're talking about in terms of whether there's a level playing field larger than where we already are.
Yeah, I'm not, that question has my guess is that there's different ways to answer it depending on what groups you're talking about. I would say in terms of the larger picture, it is definitely not leveled at all. Those who have more resources, their voice is amplified and others are not, whether that voice is correct or not. And so there's some serious issues that we have to figure out regarding that. I think in terms of local nonprofits and a leveling of the field, I've sometimes seen people fall into one of two camps, meaning that there can be a perceived competitive nature between nonprofits in terms of funding. It's something that I don't believe in personally. We've done enough research to show that at least before COVID-19, there was enough wealth that was moving into Hampshire County, for instance, that there's abilities to raise money here that is not going to be taking it from the pockets of other nonprofits. It's not a zero-sum game. So I think that that's a really important thing to remember. The only time sometimes you see that, and I think it's a little bit of a jaded approach, but more importantly, it's just out of touch with what the data is telling us.
Great, great responses throughout this whole panel's presentation. But the last question that we have is a little bit softer, but equally as important. As we talked about some of the Zoom hours and some of the fatigue and some of the weight that you take on as organizational leaders, what are some of the quick ways that you are rejuvenating yourself through self-care?
I take naps on the floor of the office.
I thought I was the only one. That's great.
Wow, John. He's been very transparent. Thank you.
Now the office floor is my home, so my wife gets a little upset.
So it helps to be an extrovert and get energy from other people. And so working with people, I mean, this sounds like a sort of, not a genuine answer, but working with other people gives me a lot of energy, and seeing other people gives me a lot of energy. But then I have the extrovert problem of then I get overexhausted by being so energized. So I have to make time alone. I have the benefit of being a farmer. And so I go out and spend time and watch my cows and just,
Nice.
Get out and working, doing physical labor helps. But being around the world that is unaffected by any of this, so basically getting outside, being in nature, is just huge. That they don't care. It really doesn't affect them at all, except that our demand for meat has gone way up. That's I think my best way of getting away from the energy of what's going on right now.
So for me, I'll say that I'm new to the area. So we've been enjoying a lot of the waterfalls and just nature, just all the wonderful vistas that we have. And as a family, we made a commitment to take one day a week to do something as a family. And it's been great. I'm a mom. I have an 11-year-old and a 13-year-old. And to just see them blossom and to take responsibility. My daughter became a vegetarian. She's cooking her own food. They are cleaning the bathrooms without being asked. They're washing dishes, loading the dishwasher every night. So it's been nice actually to work from home and to watch them blossom into wonderful, conscientious kids with little supervision or help from us or parenting from us at this time. So it's been nice that I feel like we put in the foundation and now they're able to just do it themselves for the most part. It's been wonderful.
Great. Well, I haven't checked the chat room, but I'm sure there's going to be a slew of questions as to how you get your kids to make their beds, clean their room, and do the dishes.
I have not succeeded.
But I know we're running up on time. I just wanted to reiterate just how insightful and this panel has been, and how much we appreciate each of the panelists, the Amherst Chamber, and People's Bank sponsoring this. And again, if any of you out there are looking to get an outside perspective, Prosper is offering a free session of consulting. We'd love to help you out and have that conversation. I'm going to turn it back to Claudia and just thank all of our audience members for hanging in there with us. And I know that you must have gotten a lot out of it, because I know I did.
Oh my goodness, I'm going to get emotional, so bear with me because I always do right now. It's one of those things when we talk about leading in time of uncertainty, right? We just jump in, and I love this energy. And I look at the three of you as figureheads, but today it has, and if anyone probably shares that same view of you as I do, everyone here on this Zoom today, but I think they all realize how hands-on and practical you are. You do the work. And we so appreciate that you shared doing the work, because that's what it takes with nonprofit work. You know, I did 20 years of fundraising before, you know, being at the chamber. So this work is important. It drives our economy. And it just, the fact that you three are leaders right now in this time, I'm so grateful, because this is a time where you have illuminated so many positives and so many negatives. It is just the most challenging time we have ever experienced, but you are all leading with such grace, but also with such pragmatic leadership. And I'm so grateful for that, because you're showing your humanity, and that is what's going to lead us right now. And, you know, I want to just say that we heard there was a lot of action. I've been taking a lot of notes, and we heard verbs like pivot, which is what we started with, right? This was our pivot nonprofit panel. But I heard transformation, engaging, connecting, mobilizing, responsiveness, lead, coordination, management, collaboration, preparation, fighting. So I can go on, but I just feel like you really nailed it for all of us. There's a lot going on, but that we also have to remember that it's with equity, empathy, responsiveness, humanity, and courage that we lead. So I am just spitting back to you what you've all shared, and I am so grateful, and I'm sure that the attendees are grateful. I feel like we too at the Chamber have faced a lot of these issues, and we feel you, but we're also here for you. So, and I know these leaders are here for you as well. And so I want to continue this conversation. So please feel free to reach out to the Chamber if you have more questions, because this conversation is ongoing. And I do hope to bring us all back together again and revisit some of this as we move ahead, because we don't know what fall is going to look like in this community. But I agree with all of you that, you know, we are a community that sticks together, and we've seen more resilience than ever. And I have seen more partnership than ever. And I've seen so many silver linings. So when you have a mission that you believe in and you want to drive that forward, this is the time. And if you were looking at issues to address, this is the time. And I know some people had said to me, well, you know, you don't have a lot of time to do everything, so do the things that are revenue generating. And that is true. But while that is true, you still have your broader mission to engage with. And so those are the challenges that we have to rise to and say, you know, where do we fit on the racial bias, you know, spectrum? Where do we fit on this humanity spectrum? So there's all these other pieces to us that makes our mission whole. So we're here to partner with you. I'm so grateful to all of you for the daily work that you do. You do the hardest work of all, is delivering these services to our community and filling the gaps in the community. So thank you so much. And thank you to Alex and Kevin for bringing this to us, and Eliza, Yves, John, I adore you all. Matt, thank you so much for joining us, and for People's Bank for your partnership, and everyone here, continue your good work, and we'll continue to shine a spotlight. And one of the things Eliza illuminated, we are hosting our golf tournament, and we are working with the Children's Advocacy Center, who does support families who are experiencing abuse. And, you know, they're seeing a decrease in the reporting of abuse, and that's actually really problematic. So it's always difficult to choose a nonprofit, but we did so knowing that that was something that has really been a huge issue of concern. So again, thank you all, and go out and have it a great day.